Welcome to Halifax.
Thank you. Thanks, Jim. Whoa, no pressure, no tension. Bob, thank you so much, and Jim, you just took the first part of my speech, but that's okay. I do want to emphasize that, and really to thank you all as members of Parkinson's Maritime Region for having me today. I spent the morning with your board and was really pleased to see the work that they're doing. But my primary role is that of a caregiver. My wife was diagnosed with Parkinson's 13 years ago, and as a result of that, I got involved from a YMCA perspective, but also from the provincial level in Ontario, and ultimately I have been the chair of the board of Parkinson Society Canada. I guess I'm coming up to my finish of my second 3-year term next June, when I will step down as past chair. But what I'm here today in another important capacity, and I'm honored to serve as the co-chair of the Parkinson's Canada Federation, along with John Parkhurst. He's the chair of Parkinson's Society of Central Northern Ontario, which to definitively define that is everything but the Ottawa district and the London district in Ontario. And he also is a caregiver. Through my experiences over more than 2 decades, can you hear me at the back okay? You okay? Through my experiences over more than 2 decades, most recently with Parkinson Society Canada, and prior to that with the Y, I've learned a few lessons on how partners in a federation can work together in a mutually beneficial way. A successful federation evolves over time, and we are still learning. I'd like to reflect on where Parkinson's Canada is in its evolution, and to give you some context as to where we are in terms of establishing and growing our federation. And simply put, we've come a long way, but there is more work to be done. As with any family or partnership, there are issues and challenges, and there is also tremendous potential for reward. And for the partnership to work, each person has to carve out a role that enables them to keep their identity while contributing to the overall success of the mission or the family. And an added dynamic of a federation involves managing the brand and its reputation with each stakeholder. Over the past 10 years, we have evolved from a diverse collection of charitable organizations that had one central purpose: to serve people with Parkinson's and to guide them on their personal journey to living well with Parkinson's. And today, that remains our most valuable contribution and the reason we are here. There are many opportunities, and these are exciting times. We have a shared vision, we have a shared mission, we have shared values, and collectively we are stronger. The process to a stronger organization is evolutionary, not a revolution, and we are on our way together. As a federation, we set out a strategic plan that enabled us to function with greater cohesion and efficiency in the delivery of services, and enhanced our ability to achieve our mission through participation together as members of the Parkinson Society Federation. Parkinson Society Canada's national office has 3 key roles: to deliver programs and services on a national level for research, education, and advocacy; to support our cross-Canada network of partners to ensure that our core services and support can be delivered effectively, locally, provincially, and regionally; and to lead the secretariat function of the Federation so we are stronger together. So let's look at some of the ways that we effectively integrate these roles and work together as a federation. And I'll use the Canadian Clinical Guidelines on Parkinson's disease as an example. I'd be interested to know how many people have heard of that. Not very many, okay. So for those of you, this is an initiative. Parkinson Society Canada played a leadership role in developing this important resource. 5 years ago, there was no standard for care and treatment of Parkinson's in Canada. A group of neurologists, supported by Parkinson Society Canada, met and decided that we could change that. Under the expert leadership of Dr. David Grimes in Ottawa, work began to develop these guidelines. Fast forward to 2012. After 4 years and countless hours of work, we developed and published the first Canadian clinical guidelines on Parkinson's disease. The project involved reviewing materials from the best practices of American, European, and United Kingdom guidelines and determining the best evidence-based practice points. The result was a collection of 84 recommendations for the diagnosis and the effective management of Parkinson's disease. That was really a truly accomplishment, a great accomplishment for everyone, because it marked the beginning of an important long-term education strategy that engages health professionals across Canada as well as the Federation partners. Since their launch in June of 2012, more than 80,000 physicians and health professionals have been introduced to the guidelines. We have set up a website, www.parkinsonsclinicalguidelines.ca. The website targeted to family physicians and healthcare professionals. We've also partnered with organizations like the Canadian Physiotherapy Association to distribute the guidelines to their membership of over 17,000 physiotherapists across Canada. We've also shared these guidelines with members of Parliament, senators, and policymakers as part of our national advocacy efforts. In parallel to our activities on a national scale, we are also working with each Federation partner, including the Maritime Region, to broadly disseminate this important tool that we believe is the gold standard for care and treatment of Parkinson's in Canada. Education sessions are currently and will take place in large and small communities to educate targeted groups of health professionals like pharmacists, nurses, and staff in long-term care centers. And let's not forget that while these guidelines were intended for family physicians and healthcare professionals, people with Parkinson's have taken great interest. More than 25% of the visitors to the guidelines website are people with Parkinson's and their care partners. We have armed each person with Parkinson's with a tool that they can take to their family doctor to say, let's talk about how we can manage my Parkinson's together. You can see that the impact is felt locally, regionally, and nationally. And the guidelines are just one example of how, as a federation, we work together, better together, for people with Parkinson's. Truly living the values of our Parkinson's Society brand, people with the Parkinson's first, collaboration, creativity, transparency, and empowerment. Setting standards of excellence transcends to other areas of our organization as well. Parkinson Society Canada has had a long-standing and proud tradition of funding research in Canada. And since 1981, when the program began, more than $21 million has been invested in over 400 research grants, fellowships, and awards. How do we do this? We have a scientific advisory board, which I am extremely proud of, and I've had the opportunity to meet with SICK over the last 6 years. This board are our top researchers from across Canada, neurologists, biologists, geneticists, neurosurgeons, that come together as a volunteer group. They receive all of the proposals. The proposals are sent out to all the researchers across the country. The proposals are then filtered by our staff and sent to the chair of the Scientific Advisory Board, who then are assigned 4 to 5 or maybe 6 of these very in-depth proposals that are peer-reviewed. 2 scientists from each review each proposal. They're rated, and then after that peer review process, all of the scientists come together for one day and as a meeting. We met actually 3 weeks ago to review something like 56 proposals. And they spend time and review each of their proposals that they've reviewed. They discuss it. If there's a conflict, because there's only a small number of people within the scientific community in Canada, so we want to maintain transparency. So if they're associated with a proposal in their hospital or their research center, they leave the room while the others discuss it. It's then rated, and then it goes to our scientific policy committee, which is made up of research people, a family doctor, research people who have been on the SAB or otherwise. They then look at the number of projects that are fundable based on the ratings that the Scientific Advisory Board has given. And we then rate those, and those people are awarded a project from our scientific budget. And I'll tell you a little bit more about that in a little bit. So in 2012, Parkinson Society Canada, its regional partners, proudly supported over 33 new grants, fellowships, and student awards with a new investment of $1,713,208 over the next 2 years. Is that a lot? No, we need to raise it. Including the 15 research awards in their second year, the National Research Program is currently committed to investing $2,367,153. And we make discovery research a priority. PSC-funded projects result in improved understanding of the causes of Parkinson's and lead to finding pathways to better treatments. We fund clinical fellowships to ensure more trained Parkinson's specialists are in the field in the future. We're seeing direct benefits of our investments in projects that translate knowledge into new resources, and we are making a real and meaningful difference in the lives of Canadians. In 2011, we funded Dr. Ron Postuma, a clinician in Montreal. Dr. Postuma used the research grant to develop materials to better understand the non-motor symptoms of Parkinson's, an area that was not well documented up until now. Postuma's books, The Guide to the Non-Motor Symptoms of Parkinson's for Patients and the companion Physician's Guide to Non-Motor Symptoms of Parkinson's, have been extremely popular. And Parkinson Society Canada continues to support this work and distribute the materials broadly. The resource is available for download on our website at Parkinson Society Canada, and we are going into our third reprint. Our partners tell us their clients really appreciate the booklet, along with a checklist that helps them prepare for doctors' visits. In the Maritimes, Dr. Harry Robertson, a professor at the Brain Repair Center at Dalhousie University, developed a test to measure the loss of sense of smell. He, by the way, has also been on our SAB since 1993 and recently stepped down from his role because he felt that it was time for a change. We didn't really think it was a time for a change because he's been so valuable to our committee. However, we allowed him to go. He'll probably be back in another year. Knowing that all factory changes may be detected up to 5 years before a Parkinson's the diagnosis could allow enough time to stop progression of Parkinson's. So he has, actually, he was telling me a couple of weeks ago that the grant that we in Parkinson Society Canada provided to him has allowed him to parlay that into a major grant for through the Canadian Institute of Health Research, which will take them until 2017. And this has happened on a number of occasions over the course of the last number of years, that a grant that has been received to start somebody off, that we provide the initial funding, is able to be parlayed up and move up the scale. And we have partnered with organizations like the Canadian Institute for Health Research on several projects, and leading to one of the most remarkable discoveries to date. I don't know if anybody's been watching the TV, but last week there was a huge announcement, which I'm going to talk about this now. But collaborating teams led by Dr. Ted Fawn, who happens to be the chair of our scientific advisory board at the Neuro in Montreal, and Dr. Callie Gehring in the Department of Biochemistry at the Faculty of Medicine, have discovered a three-dimensional structure of a protein called parkin. Dr. Gehring, head of the McGill Structural Biology Center, compares parkin to a watchdog for the damaged mitochondria, the power producers for our cells. Their studies show that parkin is normally kept in check by a part of this protein that acts as a leash to restrict parkin activity. When they made mutations in this specific leash region in the protein, Fawn and Gehring found that parkin recognized damaged mitochondria more quickly. This is really quite a significant discovery with therapeutic potential. If scientists can reproduce this response with a drug rather than mutations, then there is a possibility of slowing the progression of disease in Parkinson's patients. The discovery also underscores the value and importance of the National Research Program, and we need to continue to invest today to build capacity and hope for tomorrow. I think one of the other pieces to this is that our scientists around the world and in Canada work very closely together. A lot of the work that Dr. Ted Fawn did at McGill University was by the results of information and data that was collected through genetic studies that a doctor at the University of British Columbia has done, and how they've collaborated. And all the collaboration that goes on within the scientific community is actually quite amazing as they look at this particular disease. I've talked earlier about our Federation strategic plan. We completed a review of the plan and are about to launch a new plan, pending final approval from our Federation Council, which will be meeting in Winnipeg in 2 weeks. The plan defines the top priorities from 2014 to 2020 that we as a Federation aim to achieve. In order to achieve our ambitious goals, all partners need to be on board with the new plan and ensure that the regional strategic plans build on and feed into the goals set out by the Federation. So what does the future hold? The plan focuses on 4 strategic directives, and I'm going to walk you through those now at a very high level. Strategic direction is directive number 1. It's called Inspiring Hope. We know that hope is the one thing people with Parkinson's have in common. Hope for a cure, hope for better treatments, hope that each day will be okay. We need to continue to foster this sense of hope by investing in research, by driving policy changes with the government that will have a real impact on people's lives, and by celebrating our success and sharing our stories that inspire us to do more so that people understand Parkinson's. Strategic directive number 2 is extend our reach. We will reach and engage more people with Parkinson's and related conditions across Canada, and we will use technology to engage more people when and where they need us, particularly those who are unable to attend in person or in a remote area of Canada. Strategic directive number 3, strengthen our impact. We will enhance our impact on those touched by Parkinson's disease through service excellence, high client satisfaction, and broad knowledge and application of the Canadian guidelines by healthcare professionals across Canada. Strategic directive number 4, to work better together. We will achieve optimal performance to maximize donor resources, and we'll do that by implementing systems across the organization to support evidence-based decision-making, supported by a strong board governance, delivered with one unified brand for Parkinson's Canada. I tend to call that Parkinson's Without Borders. My challenge to each of you is to consider how will you personally embrace and live our values so that we are better together. How can you contribute to the overall success of your organization, to Parkinson Society Maritime Region, and to the Parkinson's Canada, the Federation? That contribution starts with a commitment to invest now for our shared growth and success in the future. And in order to be accountable to donors and to understand what inspires and motivates donors, we need to be donors ourselves. As board members and as members, we are in great position to lead by example. Let's make a promise and commitment today to take care of all our Parkinson's families, no matter where they live in Canada. We have a unique opportunity and obligation to be the national voice for Canadians with Parkinson's. Last year, through the Canadian Coalition for Genetic Fairness, Parkinson Society Canada, with active support from the Parkinson's community, helped bring genetic protection front and center on Parliament Hill. Private Members Bill C-445, introduced on October the 1st by NDP Member of Parliament Libby Davies, elevated discussion of Parliament about the possibility of adding genetic characteristics to the Human Rights Act to help end genetic discrimination in Canada. We're also seeing very positive results from work as part of our Neurological Health Charities Canada. This is an organization that was formed a few years ago with the leadership of our national CEO, who took initiative after meeting with the powers to be, the bureaucrats and members of Parliament in Ottawa, was told that you're too small to come to us for a grant, but if you brought all the neurological health charities together, we would listen much better and we would have a better opportunity to be able to help your organization. So as a result of that, we ultimately received a $15 million, we being the health charities, the Neurological Health Charities Canada, a $15 million grant through the national and through that a national population study of neurological conditions. For the first time, we'll have access to data so that we can truly make informed cases for support to and with policy makers and funders. This particular process has been going on for 3 years. I can tell you that there are 19 studies going on across Canada to look at the whole epidemiology and population in terms of better understanding all of the neurological diseases. And Parkinson's is in all 19 of them. every single one of them. I've been involved in a discussion last year around microeconomics, where a team is putting together a profile of the disease and what the impact of that is on the healthcare system, on people's personal financial systems, all of that, and it's all being done by interviewing people with Parkinson's, talking about from early onset what happened and on the way, and it's an amazing model that they're creating. All of this will be coming to fruition. It's nearly coming to an end. Bob and I actually attended a session last March, I guess, wasn't it, Bob? In Toronto, where we had an update. And I can tell you, there's a lot of discussion about way up here that I'm not sure I totally understood, but there was a lot that I did. This will be all coming to a report. I believe the timing now is March of 2014, to the federal government, to Health Canada. I can also tell you that we've also been involved in the hearings at Health Canada. I had an opportunity to speak to a select committee on issues with Parkinson's and how it impacted me personally as a caregiver. So a lot happening at the advocacy level, at the national level as well. So we are evolving as an organization and working together better. We are working better together than we have ever had. I'd like to leave you with a final message of hope that our investments in research will pave the way to significant progress in finding improved therapies and, yes, one day, a cure. At this time, I'd like to invite Jim and Bob and Dr. Eskes to join me at the podium. Would you like to? So one of my greatest pleasures is to tour the country and meet our partners and participate in research presentations. Earlier, I talked about the importance of collaboration and a strategic plan that builds capacity for all of our organizations. And part of that plan calls for a significant increase in raising funds and investing in research. And with that increased investment comes increased hope with each new discovery. Today we're honoring a local researcher champion, Dr. Gail Eskes, who you're going to hear in a little bit. Dr. Eskes leads a multidisciplinary team at Dalhousie University that is designing a computer game with mental exercises aimed at strengthening working memory of people with Parkinson's. And participants will play the computer game every day for up to 30 minutes, like an exercise program at the gym. The mental exercises start out easy and get harder, as I understand it, with people living with Parkinson's, with a working memory. Any improvements will be compared to those of another group receiving a different kind of mental training. To see which approach works better, Dr. Eskes will track the participants' scores, as well as measuring how playing the game affects participants' daily lives. Upon receiving the Psychosocial Pilot Project Grant from Parkinson Society Canada, Dr. Eskes commented that her team is hoping that in helping sharpen people's working memory, this will have an impact on their daily lives and improve their quality of life. At this Psychosocial Pilot Project and the 32 other new grants funded in 2012 exemplify how our national research program has grown and evolved to address a growing need in the research community. And we continue to invest in projects with results that can have an immediate impact on quality of life through some practical therapies, as well as providing long-term prospects resulting from discovery science. Together we're on the right path and doing the right thing. I would like to welcome Dr. Eskes to a very elite group of people. We are going to present her with the Parkinson Society, Team Canada, lab coat.
This is a surprise. They asked me for my t-shirt size. I don't understand what that was about.
All of our researchers who have research grants are the only people that wear this. They're presented with this coat. And we want to thank Dr. Eskes for sharing your commitment for a better life. I hope you will wear it proudly in your research lab and send the message. And it's all really about Canadians and living with Parkinson's today and a world without Parkinson's tomorrow, which is our vision as a national organization. Thank you.
Thank you.
Where we going? Over here.
Get a photo op. Squeeze it. Does that work? Good.
Perfect. Okay.
Thank you very much.
You're very welcome.
Voting George.
No, not yet.
Not yet?
No, just about.
We've never met a podium he doesn't like.
I know. He's going to give you the
I was
hook.
going to give it to you.
Yeah. So before I wrap up, I'd like to personally invite each and every one of you to consider joining Parkinson Society Canada in Montreal this year, October the 1st to the 4th. We are honored that Canada was selected to host the 3rd World Parkinson's Congress, and we look forward to welcoming the global Parkinson's community. I promise you this is a great opportunity to experience Parkinson's without borders, and the theme for the Congress is advancing science, inspiring hope, and promoting community. We're hoping for over 4,000 people to attend this conference. There will be scientists. You can go online and look at the website, register online. It's going to be a very exciting time. We will be hosting our award for Donald Cullen, and we'll have an announcement shortly on a very exciting person that will be receiving that. It's a researcher that is awarded every year. And I think that's about my update on Parkinson's and what's happening in Canada. So thank you so much.